We're gonna start off with palpating the soft and bony tissues of the anterior and posterior side of the wrist and the hand. Okay, so on the anterior side, you want your patient in anatomical position, which you are in. This is anatomical position. And then you're gonna palpate the radius, which is over here, the radial head, and like a little bit of the shaft, and the ulna. And then you're going to palpate in the hand, you're going to palpate the hami and the pisiform, which is somewhere in the hand. It's on the lower half of the hand, I know that. Okay. And then you want to palpate the flexor carpi ulna, radialis, not ulmus yet. And so that's on this side up here. You're going to palpate the palmaris longus, so you're going to do this. You have one, so it's right in there. I don't have one on the side.
Interesting.
See? You don't either. You don't have one. You might have, might be small. And then we're going to palpate the flexor carpi ulmus, which is going to be over here by the ulna. We're gonna palpate the carpal tunnel, which is right in here. See if they have any pain or tingling when I'm pressing.
Nothing.
I'm so glad.
Me too.
Okay, so then now we're gonna move to the posterior side. And you still want to palpate the radius, and the ulna. You want to palpate the ulnar styloid process, which is right here. It's just ulnar styloid process. You're gonna palpate the ulnar collateral ligament, which is gonna be up here, right in here by the ulna. You're gonna palpate the extensor carpi ulnaris again, which is over here as well. You're gonna palpate the radial head and the distal radius. The radius is styloid process, which is, you gotta dig in there. And then you're gonna palpate the radial ulnar collateral ligament. And then to move up in the hand, you're gonna palpate the scaphoid. And then you're gonna move over to the lunate. And then you're gonna move over to the triquetrum and the trapezium. And then you're gonna go up. It's going to be the capi and the trapezioid. I can't pronounce it very well. And then in the fingers, you want, also in the hand, you want to palpate the metacarpals to see, and then in the fingers or the phalanges, you're going to palpate as well. Palpate the thenar eminence, which is right here. I'm gonna just palpate it. And then you want to palpate the loose skin that's between the thumb and the first metacarpal. Just, see. Okay, and then you're gonna palpate the metacarpals, just to make sure. And then you want to go through each finger and palpate the ulnar collateral and the radial collateral. Just to see all the ligaments, to see if they're okay. Okay. And then while you're doing the ligaments, you can palpate through the bones, which is the proximal, the middle, and the distal portions of the fingers. But when you move to the thumb, you just have a proximal and a distal. You're gonna want to palpate those. So, yeah. And so now we're gonna move on to range of motion. So, we're gonna move to the range of motion of the wrist, which is flexion, extension, radial, and ulnar deviation. And then, so we're gonna do active first. So active, you're gonna keep your arm like this, and then this is flexion, this is extension, and then you're gonna move your arm to the radial side. Like, you can twist it and you kind of go like this. Yeah. And then you can go to the other side. Yeah, pretty much. You're supposed to do that by yourself, but it's okay. So then we're going to do passive for the wrist. So this is flexion, extension, radial, and ulnar deviation. So now we're going to move on to the thumb. And then for the thumb, we're going to do flexion, extension, adduction, and abduction. So flexion, you flex it, you flex your thumb, and you extend your thumb as far as you can. And then you're going to go adduction, you're adding it, and then abduction. So, and then now we're going to do passive of those motions. So you do it for them, like that. And then now we're doing the fingers. And then it's just flexion and extension. So flex your fingers. This is flexing.
Oh.
Do your fingers in a fist and then you extend them. Okay, so let me do that for you. So, honey, so you flex them and you extend them. You can do one by one if you want to, but
Guess you would if you were scenic ones.
yeah, if someone
A
had
certain
like,
one.
yeah, but you wouldn't want to do it if you're suspecting like a fracture or something, or someone has a deformity. So after active and passive, you want to do resistive. And so for resistive, you're going to turn your arm like this, and then I'm going to resist you coming up. So when you're flexing, don't flex your elbow, flex your wrist.
Oh, sorry.
Okay, and then do your wrist flex, and then I'm going to resist you coming down. Okay. And then ulnar deviation, you're going to go that way, but I'm resisting you. So like this way. Okay, not this way. Okay. For your thumb, flex it up or extend it, and then flexing. Okay. And then add it go like that. And then there you go. Okay, for the fingers, I'm resisting flexion and extension. So we're extending, and then you're flexing. Okay, good job. You have nothing wrong with you.
Good.
So next we're gonna move to the goniometry, when you measure how much flexion, extension, or abduction or adduction someone has. I don't have one, so I'm just gonna tell you. So for the wrist, you want the arm pronated, so you want it like this. No, you want it like this. This is pronated. And you want the fulcrum on the styloid process. The unmovable arm, so the stationary arm, you want it on the shaft of the ulna. And the movable arm, you want it up the fifth metacarpal, or fifth metacarpal and phalange, so you want it like that. And then you just have them do it. I obviously don't have one. So, and then for the fingers, you want it to be on the top side, so the dorsal surface of the hand, and you want the fulcrum to be on the surface of the capitate. So right in here. So right in here, you want the non-movable arm on the shaft of the forearm, so like between the radius and the ulna, and the movable arm on the finger that you are testing. And then for the thumb, you want the arm, the elbow is at 90 and the arm is supinated, so like this. Yeah. Actually, your arm's gonna be more like this. And then you put the stationary arm at the shaft of the radius, so right here. The movable arm is going down the first metacarpal, so down the index finger, and the fulcrum is going right here at the radial styloid process. For flexion and extension, it's different for adduction and abduction. So for the thumb, abduction and adduction, you want them supinated with the thumb up and the elbow at 90. You want the fulcrum to be still at the radial styloid process. You want the movable arm at the first, still at the first metacarpal joint, so like the MC, like the knuckle, and the unmovable arm down the radius. So yeah, and so now we're going to be testing the dermatomes and myotomes. So we're gonna do C6 through T1. Okay, so now we're gonna do dermatomes and myotomes. Okay, so we're gonna do C6 through T1. I'll just edit this out. Okay, so close your eyes. Arms are in anatomical position. You can keep them down. Does C5? Okay. Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Okay. Does this feel the same as this?
Yes.
Okay. So now we're going to go to myotomes and C6. So what we're doing, we'll do this elbow, is you're pretty much flexing it. So you're like bringing it up and bringing it down. Oh, I got it. So C8 is this, and then this. Okay. And then T1, you're gonna do this. So you just check the fingers, pretty much. Okay, that's all we're doing for that. Okay, so now we're gonna do varus and valgus stress tests of the wrist and the fingers. So you're gonna want to put one hand, you really can put them right here. You're gonna put one hand on the radius and ulna, and the other one kind of like around their hand. You're gonna just push on one side and pull with the other. This is a varus stress test, I want to say. And then for the valgus, you're gonna want one hand and then their here, and then like that. That's a valgus. And then this is a varus, where you're doing it. And so for that, it's the same with the fingers. Here, we'll do anatomical position. And you just grab at the distal portion of the finger and the proximal, and you just apply pressure and pull. You want to do that with each of the fingers, but we're not going to go through each of the fingers. So, and then for, if you're like splinting them, you want to just do check their capillary refill in their fingers. You just press down on the fingernail. Okay, and so now we're going to move on to medial and lateral epicondylitis. So I'm going to do, for lateral epicondylitis, I'm going to do the tennis elbow test. And so you sit and you do like this, and you palpate the radial elbow, which is right here. I really forgot how to do this. The test we're gonna do is Finkelstein's test. And so you're gonna put your arm on the table, and you're gonna make a fist, but your thumb is gonna be underneath your fingers. Does that hurt?
No.
At all?
No.
Okay. If she had any pain, she would have de Quervain syndrome, which is tenosynovitis along the tendons. So you're negative. So
Good.
The next test we are doing is digital Allen's test. And so your arm is here. I'm gonna have to sit down. I hope I'm in the shot. Because your arm is gonna be up like this, and you're gonna go like this several times. Okay, and then keep doing it. Okay, now you can stop and relax your hand. Just relax. And then you're gonna, I would put pressure on the radial and ulnar artery, so do it again. Go like this several times. Keep going, keep going, keep going, keep going. Okay, you can stop and relax your hand. Extend your fingers. And then you want to like let each artery go at a time, and you want to watch to see if it like flushes, if your hand turns pink again. Because if not, there's a delay. Like that's an issue if it doesn't flush back. So it obviously flushed back, so you're good.
We're good.
That's all we have. Lateral and medial epicondylitis. And so for the lateral epicondylitis, I'm going to be doing the tennis elbow test. So we're going to have our patient sit, and her elbow is going to be at 90 degrees. It's going to supinate, and I'm palpating the lateral epicondylitis while my other hand is resisting wrist flexion. Actually, I think that's wrist extension. Do you have any pain?
No.
Okay, good. So you don't have tennis elbow in this arm.
I got it on the farm though.
Yeah, you do. It's bad. Yeah. Okay, so now we're going to move on to medial epicondylitis. And for that, we're going to do golfer's elbow. And so you're going to make a fist. We're going to have our patient. Her elbow is still going to be at 90, and this time I'm palpating the medial epicondyle. And I'm passively moving the arm into supination to see if she has any pain along the medial side. Do you have any pain?
No.
Okay, you don't have golfer's elbow.
That's good.
Okay, so next we're gonna move to the Tinel sign. So for that, your elbow is gonna be slightly flexed and standing. I'm grasping your wrist. So it's gonna be slightly flexed. It's like that, and then you're tapping the ulnar groove. Do you have any pain?
No.
It's negative.
Good.
Okay, so the next test you're doing is the pinch grip test. So do your thumb and your index together and bilaterally. Okay, so that test is negative. And then we're going to do Phalen's test, which is for carpal tunnel and then median nerve impingement. So you're just gonna you're gonna go like this, and you're gonna push your hands together. Do you have any pain?
No.
Okay. Test we're gonna do is Finkelstein's test, and so you're gonna put your arm on the table, and you're gonna make a fist, but your thumb is gonna be underneath your fingers. Does that hurt
No.
at all?
No.
Okay. If she had any pain, she would have de Quervain syndrome, which is tenosynovitis along the tendons. So you're negative. So
Good.
the next test we are doing is digital Allen's test. And so your arm is here. I'm gonna have to sit down. I hope I'm in the shot. Because your arm is gonna be up like this, and you're gonna go like this several times. Okay, and then keep doing it. Okay, now you can stop and relax your hand. Just relax. And then you're gonna, I would put pressure on the radial and ulnar artery, so do it again. Go like this several times. Keep going, keep going, keep going, keep going. Okay, you can stop and relax your hand. Extend your fingers. And then you want to let each artery go at a time, and you want to watch to see if it flushes, if your hand turns pink again. Because if not, there's a delay. That's an issue if it doesn't flush back. So it obviously flushed back, so you're good.
We're good.
That's all we have. Lateral and medial epicondylitis. And so for the lateral epicondylitis, I'm going to be doing the tennis elbow test. So we're going to have our patient sit, and her elbow is going to be at 90 degrees. It's going to supinate, and I'm palpating the lateral epicondylitis while my other hand is resisting wrist flexion. Actually, I think that's wrist extension. Do you have any pain?
No.
Okay, good. So you don't have tennis elbow in this arm.
I got it on the farm though.
Yeah, you do. It's bad. Yeah. Okay, so now we're going to move on to medial epicondylitis. And for that, we're going to do golfer's elbow. And so you're going to make a fist. We're going to have our patient. Her elbow is still going to be at 90, and this time I'm palpating the medial epicondyle. And I'm passively moving the arm into supination to see if she has any pain along the medial side. Do you have any pain?
No.
Okay, you don't have golfer's elbow.
That's good.
Okay, so next we're gonna move to the Tinel signs. So for that, your elbow is gonna be slightly flexed and standing. I'm grasping your wrist. So it's gonna be slightly flexed. It's like that, and then you're tapping the ulnar groove. Do you have any pain?
No.
It's negative.
Good.
Okay, so the next test you're doing is the pinch grip test. So do your thumb and your index together and bilaterally. Okay, so that test is negative. And then we're going to do Phalen's test, which is for carpal tunnel and then median nerve impingement. So you're just gonna you're gonna go like this, and you're gonna push your hands together. Do you have any pain?
No.
Okay. Okay, so I'm going to do my function and activity specific tests, but I'm just going to tell you about them. So I chose an interphalangeal joint sprain, which is like a finger sprain of the ulnar or radial ligaments. And I chose it in a basketball player because I know those happen very commonly by the ball hitting the player's finger. And so I know it's from like an axial force that produces a jammed finger, so the athlete may unjam it himself before he even tells you, just so he can go back into the game. But if he does tell you, I think you should splint it and let him be able so it doesn't get hurt anymore. The functional test that I would do is a varus and valgus stress test. And then an activity specific one, I would be like seeing how they I would take them out to the court once I think that they are ready. And I would throw a basketball at them and see how they catch it, to see if they like jam their finger again or a different kind of finger. So I think this is like the most common injury that I could think of in even a basketball player. And it could be like any one of the fingers. It can be the first metacarpal, the second, the third, or the fifth, or the thumb. It could be in any finger pretty much. So I would just see how they do.